My name is Rick Weisler. I'm a professor of psychiatry at the University of North Carolina on an adjunct basis and also at Duke University Medical Center and in private practice. And I want to share with you today some information about an epidemic of unintentional drug poisoning deaths and poisoning deaths that we're now going through in the United States. And I want to thank especially Lynn Palazzi with the Centers for Disease Control and Prevention Unintentional Injury Branch, who has been a co-author with me, and we worked together, who shared some of his slides from a recent presentation. So what I want to show you first is just the fact that, as you can see in this graph, there's been a dramatic increase in the number of drug poisoning deaths that have occurred since the 1980s up until 2009 on the far right of the slide. At the same time, you can see that the motor vehicle accident deaths have actually declined. And so as of 2009, and the CDC runs a few years behind because they're trying to confirm all the deaths and make sure that they're coded properly. As of 2008, 9, that kind of time period, these poisoning deaths passed motor vehicle accident deaths, which have been the leading cause of unintentional injury deaths for about 85 years, a long time. And this trend, as you can see in the next slide, looked at all intents overdose deaths, and there are a number of deaths or overdoses were actually suicides. But if you include those together and things like that, you'll see opioid analgesic deaths are close to around 16,000 deaths as of 2009, and that's a huge number, and definitely much, much larger than what we saw with cocaine and heroin during that time period, which have stayed relatively flat, though they've increased a little bit too in recent years. But the trend changed in the late 90s as we're trying to deal with pain management as well, and trying to find that balance is a really hard act and issue for clinicians as we're trying to be humane and caring, at the same time not overdo it. So that's tricky. If you look at the next slide, you can see that opioid pain reliever death rates and sales, for the most part, follow the same trajectory over that 1999 to 2010 time frame. And there's again, looking at intent there, a high number of deaths that were by opioids, whether you looked at hydrocodone, oxycodone, morphine group, hydromorphine or methadone, or the fentanyl, meperidine, and so on combination. So when you add them all together, though, we're ending up with a very, very large number of people dying. And the states are a little bit different, as I'll show you in a minute in a different slide. But around the country, there were about 14,800 deaths, as you can see in this next slide, from opioid analgesics. And notice that a lot of these were overdoses without a benzodiazepine. You'll see further down at the very bottom of the slide, there were actually 5,000 overdose deaths with benzodiazepines, where it was felt to be a cause of death. And of those overdose without an opioid analgesic, there were 1,377. Now again, antidepressant overdose deaths, in contrast, have changed quite a bit over the years as we use fewer tricyclic medications and more of the new medications. There were 3,610 overdose deaths, and again, overdoses without opioid analgesics were only 1,662. Now, there are a lot of emergency room visits. Our emergency rooms are jammed with people, and as you can see, many of the visits, 1.2 million almost, were related to pharmaceutical medications, okay, and pain relievers, roughly around 0.6 million people visit the emergency rooms. Benzodiazepines, right around, again, 0.4, and a lot of illicit drugs too, but marijuana, cocaine, and heroin were less frequent than these. So again, prescription drugs, pharmaceuticals are becoming more common. And you can see in this next slide that, you know, marijuana is one of the main reasons. Again, non-medical use is self-reported, but pain relievers are right around 4.8%. Tranquilizers around 2.2, and stimulants around 1.1. Cocaine and heroin, cocaine was 1.8, and heroin was 0.2. Now, keep in mind with all those deaths, that's just the tip of the iceberg, is what we know. So for every opioid-related death, roughly 16,000 in 2009, there were 9 substance abuse treatment admissions, so 9 times the number of deaths. 30 ER visits for those deaths, and 118 people who would be diagnosed with dependence or abuse that didn't die, thank goodness. And past year non-medical users, 795. So for every death, there were almost about 800, roughly, non-medical users. Now, when you look at the non-overdose impacts of widespread opioid analgesic use, and again, we're not talking about appropriate use, we're finding more falls and fractures among some people, certainly more motor vehicle accidents involving drug driving, just like drinking and driving. And drug driving can be a major issue and cause of death. A fair amount of substance abuse can lead to crime because there's a value, a street value, in fact, sometimes significant, $1 to $2 per milligram of a lot of these drugs is what they go for on the street. And again, there can be IV use as well, so you get spread of illness and reproductive health effects as well. Now, if you look at the age group, a lot of us have the misconception that it's just the young. But if this graph shows you the drug group that has the highest death rate are actually more middle-aged, peaking around 35 to 55 years of age, and then dropping off some after that. But it can happen at any age, and any death is one too many. If we can prevent them, that's what we need to do. And you can see in this chart, too, that the suicide drug overdose death rates are a fraction of what you see for the unintentional drug poisoning deaths. Now, undetermined are where the coroners can't decide, was it an accident, was it a suicide, and that's a much smaller number as well. And the opioid prescriptions per person by age group go up as we get older, as you can see in the country. And we're talking about here huge numbers of prescriptions over the year, but we're talking about 2 prescriptions for people over 60 versus, less than 1 for people up to age 29. Now, this map of the U.S. shows you graphically how widespread this epidemic is. And if you notice, the darker colored states have higher rates of death from unintentional drug poisonings, and also have, again, higher sales. So in the circles, the yellow circles, you'll see the sales rates for opioids in those states, and notice that frequently they correlate with the darker colors, translating into higher death rates from unintentional drug poisoning deaths in those states. The Midwest area, there's certain areas with relatively low rates, and there are a lot of areas in the country, as you can see, like Florida, West Virginia, Ohio, New Mexico, some other states with very high rates. And history of substance abuse in the next slide clearly looks like it is a major issue. This was a study of deaths in West Virginia. Other mental illness, 42.7%, but again, a history of substance abuse in those who died was around 78%. Almost 4 out of 5 people had that history. And non-medical route of administration can be a big issue too, and if there's a prior history of an overdose, the risk goes way up as well. Now, looking at percent without a prescription, in this next slide, you'll see there are quite a few people that aren't being prescribed these drugs who are dying. They're getting it from somebody else, either theft on the street, borrowing it from a friend, what they call farm parties, PHARM parties, where they share things. And again, a Medicaid population may be a great risk too, methadone population, as you can see in Ohio. And there's a fair amount of doctor shopping. And if more doctors they see, 5 or more prescribers, for example, in this first bullet, they had a much higher rate of death in Ohio, West Virginia as well. So more people they're seeing, they're prescribing opioid-related drugs, the greater their risk. Now here is a crude association of the number of prescribers per patient with the risk of unintentional overdose death in New Mexico. And again, pretty clear trend with mean number of prescribers on the far right of the slide, showing you about, again, 8.2. And here's the daily dose, showing a very high rate of death as you start getting high doses of mean daily morphine equivalents, milligram equivalents, versus lower doses. And in summary, really important, we want you to be aware there is an epidemic of fatal overdoses in the country right now. It's largely driven by misuse and abuse of opioid analgesics. And there are multiple far-ranging health and societal implications, as we talked about. A higher rate clearly among males, middle-aged, non-Hispanic whites in certain parts of the country, but all groups, I would tell you, are vulnerable, all age groups. You have to be aware of it. Substance abuse and mental illness are common, and some persons use diverted drugs in doctor shop, and the more prescriptions, number of prescribers, and the higher the daily dose, the greater the risk. So I want to thank you for that. There's a lot of great information on the CDC website, as well as in the journals, and I hope that we'll all work together to try to do something about this great epidemic.